Good afternoon. Thank you for joining us for today's QC COVID-19 press briefing for the Quad Cities. Today is Wednesday, May 20th. Today we have with us Janet Hill, Chief Operating Officer for the Rock Island County Health Department, Ed Rivers, Director for the Scott County Health Department, and Dr. Katz, Medical Director for the Scott County Health Department. Each of our speakers will have prepared statements, and then following that, we ask that you type your questions into the chat, and we will address your questions after the prepared statements. First, we're going to start off with Janet Hill from Rock Island County Health Department. Janet, please provide us your numbers as well as your speaking points for today.
Hello, everyone. Thanks for joining us. Today, we are reporting three new cases of COVID-19 for a total of 648 and one new death. The patient was a woman in her 90s. So that we now have 24 deaths from COVID in the county. So each day for more than 2 months, we've described people who test positive for COVID-19 in broad terms to protect their health privacy. A man in his 50s, a woman in her 40s, and 4 times now an infant younger than 1. Days later, we might describe a patient after he dies. We say man in his 50s, but his family might know him as husband, dad, and grandpa. Our contact tracing team gets to know these families, and their grief takes a toll on us. Early in this response, on a Saturday in March, I sat with our chief nurse who was interviewing a woman who would become a widow a short time later. I teared up just listening to our nurse doing her job while offering comforting words. Just this week, one of our newly trained contact tracers hung up after an interview and started sobbing. She took on the grief of someone who had just lost her husband. In public health, we protect health at the population level. We use a statistic that calculates premature death. It's called years of potential life lost. The calculation is simple. The age of death is subtracted from a predetermined number. In the U.S., that number is 75. The difference is the years of potential life lost. People are dying before their time from COVID-19. This week, we announced a man in his 30s had died. That's up to 45 years of potential life lost. 45 years. What would he have accomplished in his lifetime? We've asked you to change your everyday life for weeks now. We know this is hard and even a burden, but your efforts have started to work. We are seeing fewer cases in Rock Island County, even as testing becomes more available. Your efforts are slowing the spread of this virus. Soon, Governor J.B. Pritzker's stay-at-home order will lapse, and all Quad Cityans will have decisions to make about how we react. Governor Pritzker announced new information for Phase 3 openings about 30 minutes ago, but we ask that you still exercise caution when you go out and avoid gatherings of larger than 10 people. You should still wear a facial covering. You should still keep at least 6 feet between you and others. We've come too far to go backwards now. We're all ready for a vacation, but the virus isn't taking a holiday. Good public health means that each of us owe it to each other to protect all of us. Your decisions potentially steal years from others. Ed?
In Scott County, on Monday, we reported 309 cases. Yesterday, no cases were added to the state website. Today, 3 were added for a total of 312. Our deaths on the website stand at 8. And as Janet expressed, each of us, as residents of our community, have a responsibility to protect ourselves and others around us from COVID-19, even as we're starting to see fewer cases of illness. That includes listening to the public health messages we have shared over and over. Only go out for essential trips. Maintain at least 6 feet of physical distance between yourself and others. Wash your hands and stay home when you're sick. So today I've asked Dr. Louis Katz, the Medical Director of Scott County Health Department and a preeminent authority in infectious disease, to join the briefing to help express the importance of continuing to respond to COVID-19 as a community. We have asked him to address what the future looks like for this virus in our community and why it is that we can't expect to go back to normal in the near future. Dr. Katz?
I don't have a crystal ball, so don't hold me to what Ed has asked me to do. I think it's extraordinarily encouraging. We're now, Rock Island County is looking past the peak. We believe Scott County has been past the peak for 10 to 14 days at least. And that's extremely encouraging. My criteria for reopening that I think are pretty well known are a sustained decline in case counts for more than 14 days, adequate hospital capacity, both of which I think we have reached, contact tracing capacity sufficient to do detailed contact tracing on every new case, which we have as long as activity stays low. If we enter a second wave related to reintroductions after reopening or continued community spread from asymptomatic transmissions, my assessment is that we can easily exceed our contact tracing ability, and that might be associated with a second wave of completely unknown magnitude at this time. So I think the best thing that I can say at this point is that despite the reopening that has been permitted in Iowa, and it is likely coming in the next couple of weeks in Illinois, I personally have not changed anything. I am avoiding all external contacts that I can, consistent with doing my jobs, and staying put. And I encourage residents of Scott and Rock Island County at this point to do the same. Iowa is a large place with diverse COVID activity. Quad City metro area has had substantial activity until recently. I don't really look at Rock Island County and Scott County as separate. So while I'm getting comfortable that Rock Island County is past the peak, I'm not certain yet, and I'm encouraging people to do exactly as Ed has said, which is maintain the interventions that appear to be bringing control to our local epidemic. If we look around the U.S. for the impacts of reopening that's being done differently in multiple jurisdictions, they're very mixed at this point, from no impact on the case curve to substantial early increases in places like Florida. I'm being asked a lot now about the value of antibody testing, or serology, as we call it. And as I said to a reporter from KWQC yesterday, in terms of the general population, absolutely not ready for prime time. Highly valuable when used longitudinally, that is, repeated surveys over time on appropriately assembled population samples to assess the spread of the virus in the population. Very valuable from a public health standpoint. We're using serology extensively at Mississippi Valley Regional Blood Center in order to qualify donors to give convalescent plasma. That is being used in our 4-state, 115 hospital system as a treatment modality. Beyond that, very little use. Most importantly, I want people to understand that we do not understand what constitutes immunity to this virus. If you have measles and have measles antibody, you're immune to reinfection. But the counterexamples are many. HIV antibody is present from the outset of infection and is not protected. Hepatitis C, the same. Many bacterial infections, antibody does not result in what we call sterilizing immunity. With COVID-19, we do not know what kind of immune response constitutes evidence of immunity. So the fact that people have antibody cannot be used to make the statement that they are in fact immune and can return to work or visit their grandchildren, as I said yesterday. So everybody needs to take a deep breath about serologic testing. It has virtually no utility in the short run for individual patients until we understand immunity and the performance of the test much better than we do now. The last thing that I wanted to say is that as reopening has proceeded in many areas in the upper Midwest, the need for blood donations has rapidly increased, and there are shortages all over the upper Midwest and most of the country as reopening continues. So I want to encourage the media and the public to pay attention to donating blood, get a hold of the blood center, schedule an appointment, and come in and give blood. And I'll take questions if anybody has any.
Thank you very much, Dr. Katz. We do have a number of questions here, so we'll start from the top. The first question that we have is for both health departments. Perhaps we can start with you, Ed. Health departments in many states share people who tested positive for COVID with local law enforcement. Can you please describe how that sharing is done?
Yes, we're required to share that information by our Department of Public Health with the Public Safety Answering Point, or PSAP, which in Scott County is a Scott Emergency Communications Center. We do that, provide that to them daily. It is entered into their database, and there it remains until a call is dispatched for that location. And it is provided to the first responders and the law enforcement personnel who may be responding to the scene. Additionally, we do work with first responders and public safety people who have been exposed to a case and provide guidance and assistance if necessary.
Okay, and we did have a follow-up question to that, Ed, which was how frequently is that information turned over? So I think you addressed that in that answer. Janet, are you able to speak to this for Rock Island County?
We provide that information daily to the Emergency Management Agency, which shares it with local law enforcement. That was a local decision. The state is not requiring that, and we have always cautioned that the list is not being updated. So someone could have tested positive back in March and is still on that list. So we want the first responders to always practice safety while going to different homes. I mean, because we do not know exactly who has this disease and whether they have tested positive or not.
We have another question for you as well, Janet. There are now multiple children under the age of 1 who have tested positive for coronavirus in Rock Island County. Some national reports show that younger children may experience multi-inflammatory syndrome if they become in contact with the coronavirus. Have any kids shown its symptoms, and are you handling their cases any differently than adults?
We have not seen any cases so far, though we do know that it's relatively nearby. I believe there was some cases in eastern Iowa, maybe Cedar Rapids. But physicians are well aware of it and are watching for it. So if we hear of some cases, I expect that we would share some broad descriptions about it.
Dr. Katz, would you like to give any insights regarding the inflammatory syndrome that is being addressed in the question?
Yeah, since this has been recognized primarily or initially on the East Coast, it's been described fairly well in the media and on preprint servers in unpeer-reviewed publications. Looks very much like something that we recognized many years ago called Kawasaki syndrome. And it's pretty easy to recognize once people are thinking about it. So my suspicion is that our local pediatricians and family practitioners will not have any difficulty recognizing the syndrome should it occur. There's no specific treatment for it. It's supportive care and a recognition that if you see something that looks like Kawasaki syndrome, you need to consider COVID-19.
We do have another question for you, Dr. Katz. Are the antibody tests that Iowa is using or plans to use good? Do they have the specificity and sensitivity you and other experts like to see?
The tests being done at State Hygienic Lab, my impression is they're pretty good tests. But most of our understanding is coming from testing in very selected populations, especially our convalescent donors, who have an extraordinarily high pretest probability of being positive. Their performance characteristics in the general population are not well established. And to give you an example of how critical that can be, a serology test that is 95% specific, that is, has only 5 false positives for 100 people tested, when used in a population with 5% or fewer people who are actually infected, is no better than a coin flip in terms of giving information to the person being tested. So we have that problem that the penetration of the virus into the population is not to a high proportion yet. So these tests are still of questionable use in individual patients. And then, as I said earlier, we have no idea what the presence of antibody in either of the tests being run at state lab means for immunity. So my guess is that among the 12 emergency use authorization antibody tests that FDA has cleared for use, they're probably okay, but not for what people are looking for, not as an immunity passport to return to work or go visit the kids. Give me a month or two, and I'll have a much better idea, but we're not there yet.
So can you just help describe the current use of them by, it says scientists or likely public health. What is that telling them based on the use of it currently?
Well, the public health value is to sample the population, do random samples of the population repeatedly or continuously over time, and look at the prevalence of how the prevalence of antibody, how the percent of tested individuals in a restricted time frame changes over time. We're estimating now that herd immunity will require antibodies either from vaccine or infection in something like 2/3 of the population. Somewhere between 60 and 70% of the population will have to have antibody that confers immunity before sustained community spread stops. By the time we're anywhere near that, we'll have a much better idea of the performance characteristics of these antibody tests. So gathering the data now is very, very important. And it's essentially looking at one survey now is not so useful given the unknown, uncharacterized performance of the test, but looking at the trend over time will be of incredible value.
Thank you. This time it doesn't look like we have, we do have one additional question that just popped up here. This was in regards to the antibody testing as you were talking about. Is random sampling being done in Iowa or just convalescent patients? Are you able to speak to that?
The data that I've seen, certainly we're using them in convalescent patients, people who have had a molecular diagnosis. And we strongly expect almost all those people after recovery to be positive. And that's what we're seeing. What we're really looking for is high levels of the antibody to select the best donors to make the plasma. With regards to the antibody data that I have seen to date, no, it's not random. Overrepresents women, is not being conducted using statistical sampling methods that get us a true random sample of the populations of interest. We'll get there eventually. The studies are being planned. They're just not, there's no data available to date that I consider to be from appropriately sampled populations. Patience, patience. It takes time to set these things up.
Well, thank you to Janet, to Ed, and to Dr. Katz. We are going to conclude our call for today. We appreciate everyone for joining us, and we will be back on tomorrow, so please plan on joining us for our additional information that we'll be sharing. So thank you all. Have a nice day.